everybody. How are you? Welcome to Conversations with MM. This is Marivier Montebon here in New York, in Woodside, still in my bedroom in a different spot. So it's really convenient to have this technology right now so we can make conversations of issues so accessibly in our own homes. So, how are you? August is about to be gone. It's the 31st. And September na. It's the last quarter of the year. Ako, 2022 is going away fast. I hope everybody's doing well and classes are on. I am also preparing for my classes. So, I bought books and mentally preparing myself. So for now, we are going to have this conversation. Our topic is about a health concern in the Philippines, and I have a very special guest, a very good friend, who is a warrior for health advocacy of concerns on women and equality and media as well. So we are going to talk about the problem on clubfoot. This is in our language, Tagalog and Bisaya. It's kapingkawan, meaning that deformity on the foot and or feet. So tonight we are going to have the executive director of the Philippine NGO Council for Population Health and Women Concerns. Did I say that right? That's quite a long acronym. But without further ado, I'd like to welcome the wonderful Miss Chi Laigo Vallido. Hi, Chi from Manila.
Hello, magandang
Chi.
good. Hello, what a kind of introduction naman. Thank you so much for that introduction. Magandang araw.
Magandang
To
araw.
be
Magandang
safe.
gabi dyan. Umaga
Magandang
pa
gabi
dito.
sabi.
We're 12 years, 12 hours apart. Not 12 years. Anyway, so Chi, how have you been? Kamusta na ang buhay-buhay dyan sa Pilipinas?
I'm doing well, going back to the swing of things after 2 years. So we're starting to visit the clinics again. We're starting to do some face-to-face trainings, and like the couple of years na talagang puro virtual, puro online.
Yeah,
We're just on our mobile phones most of the time. So yeah, so I think there's some sense of normalcy, except that you see people wearing face masks. But other than that, I think people are slowly getting back to the normalcy of their lives.
that's great. Um,
Mm-mm.
Tell us about this problem on club foot and then kapingkawan, and then what is the PNGOC doing to help children with this problem?
Okay. Well, the Philippine NGO Council, we work a lot on many health problems,
Mhm,
health issues, in particular sexual and reproductive health.
mhm.
So kasama na din dyan maternal and child health. At one of our programs now is really addressing the problem of clubfoot, treatment of clubfoot in the Philippines. When we say clubfoot, and this is something that I also learned, no, the kaya siya clubfoot is like a golf club when the
Yeah,
legs are really
parang,
inwards.
parang
Yeah,
bent.
just like naka-bench siya. So it's either one foot or both legs, or tinatawag nilang bilateral club foot. Both legs are
Oh,
bent inward. So
ano cause yan, Chi? Is
well,
that
according, yeah.
nutritional problem sa nanay?
No, actually,
Or
a lot of the doctors are saying that up until now,
mm,
even when we have a lot of cases worldwide, here in the Philippines, kasi sabi with 1 in 800 children are born with clubfoot. Here in the Philippines, we have about 3,500, more than 3,500 children born every year with clubfoot, and the doctors still are puzzled as to how it happens. No, there's a theory that it's also genetic, because we see mothers also with
oh,
clubfoot, and then giving birth to a child with clubfoot. but
I
it
see.
really has nothing to do with yung mothers not taking care of themselves, etc. No, because it cuts across actually a lot of social strata.
So
It
it's
just
not even
happened.
poverty driven, huh?
No, it's not at all.
So what is PNGOC doing for
well,
the program? What are you campaigning for this
well,
deformity?
Yeah, well, PNGOC, through the generous support of Miracle Feet, this is a foundation, an organization based in North Carolina.
Mm-hmm.
You work with us to allow us to help facilitate the treatment of clubfoot. So we work in partnership with 30 hospitals all over the country.
Wow.
So we help facilitate yung treatment by providing yung mga casting, yung special shoes and braces, because these things really cost a lot if you're going to buy them. So all these things are provided by our funder, Miracle Feet, and they work in many countries, not just here in the Philippines. So we're very fortunate that they have partnered with us so that we can also provide this to our beneficiaries, to all these babies, because it
So
really costs a lot.
how much is it? Is the entire process of the therapy? Is that called therapy for the kids, or there's also surgery?
Um, Actually, what we are using now, what our facilities are using is called the Ponseti method. So this is a method that is perfected by Dr. Ponseti. So it really uses casting, a series of casting,
I see.
and then tenotomy. Ito yung pinapaliwanag niya sa amin, where they really cut yung litid sa likod ng paa ng bata, na it takes about 10 minutes. So it's really
Oh,
very not invasive at all. Pero more than 90% of cases using this method ay gumagaling. So the clubfoot is really corrected using this method. In fact, in the US, it's something that is done,
easily.
yeah, easily, because they're really familiar with the method. I know that there are a lot of also celebrities that have been born with clubfoot. I don't know if there's Damon Wayans. He's a Hollywood actor, famous in the 80s and 90s. We also have an Olympian. I know Christy Yamaguchi, the US Olympian figure skater. I know that she was born with bilateral clubfoot, but she was also treated. So here in the Philippines, we're starting to still get to know more about this problem. Kaya we're also trying to reach out dun sa mga media natin, no, trying to get more information out there na meron tayong mga treatment facilities, and they don't have to worry about the cost, kasi halos libre po 'yan dun sa ating mga partner hospitals. Kaya pumunta sila doon, because our culture, pag pinanganak, and I've heard this from a lot of mothers, sasabihin nila, o wag mo na ipagamot yan dahil swerte yan. O baka pinaglihim mo yan sa alimasag o alimango,
Talagang
because
swerte talaga ang tawag.
hindi, kasi yung alimango daw, yung leg daw nung yung mud crab,
Yeah,
di ba?
just that
When you
cultural
see,
factor, huh?
so you probably ate a lot of mud crabs or crabs.
No.
And then it's lucky, don't get it for treatment, and some of them even take it sa manghihilot, which actually worsens the situation. That's why when we go around when I started going around the provinces, going back to the clinics, I try to really reach out dun sa mga media natin to really get the information out there, and we
Mm-hmm.
have to really get to the children in time bago siya mahilot-hilot dyan.
Yes. So how long, for example, ang bata ay magkaroon ng therapy? Like 5 years ba? 1 year?
Mhm. Or even earlier, pag maaga siya talagang na-treat,
How long does it take to correct?
um, actually, yung iba nga, mga nakikita namin, after a year or so, nakakalakad na sila. Pero syempre, continuous pa rin yung paggamit nila ng braces, up to 3 years, I think. But the doctors are saying na even if makorek na siya yung paglakad na niya, kailangan palagi pa rin may follow-up because children keep on growing, eh, lalo na 'pag halimbawa biglang nagka-growth spurt 'yan. So, sometimes they also get some relapse. So, dapat continuous pa rin yung training and therapy nila. But at least by that time, yung kanyang paa talaga na-correct na and I've seen it. Itong baby na 'to do'n sa picture, siya yung nando'n sa unang picture natin na nakita mo yung both his legs ay
Oh,
talagang nakaano, ayan na siya, nakadiretso na. Gano'n yung paa niya, yung sa unang
this one.
pinakita. Yes, that's him. And look at him now, no? Diretso na yung paa niya after a few
Ilan
months.
taon na siya
I
ngayon?
think ngayon ay 11 months siya diyan, eh. So,
Ah,
we're looking at
so
siguro
okay
a
na
few
'to.
more months makakalakad na siya.
Ang cute
Oo.
ng shoes.
Oo. So, yung mga nakikita namin na ganyan talagang na-inspire kami kasi 'pag nakikita mo yung change. That's
It's
why
like significant.
sabi namin, we really have to get to the kids in time because the treatment is time sensitive. So,
Oh,
halos weekly talaga sila. And can you imagine itong last 2 years, marami kaming mga kids na talagang hindi sila nakabalik talaga for treatment. So, marami ang na-relapse.
pandemic.
Because of the lockdowns, they
Ah,
couldn't get to the treatment. And a lot of our hospitals, sila yung nagamit din for COVID response. Wala tayong magagawa talagang,
right.
globally ang problema na yan. So we really have to address that. And ang hirap kasi 'pag baby walang nagkakasya na mask diyan. So kailangan
Oo.
mapo-protect mo talaga sila. So it had been very, very hard on the parents in the last couple
So
of
now
years.
it's getting better. The
Yes, at
services
least
are back.
oo, nakikita mo yung sa picture na yon,
Mm.
that's in Benguet, and then ito yung reunion ng mga children. They
Oh,
finally were able to really go back and then get some follow-up treatment. May mga dumating din diyan na mga bagong babies coming from other areas, no?
mhm.
Actually, among all our hospital. I'm sorry?
Sino itong doctor na 'to?
That's Doctor JP Leong. He's
Ah,
from the Benguet General Hospital.
so he did the therapy or the casting, whatever it is.
Mhm, mhm. He is in charge of the ortho department of Benguet General Hospital. So he's also one of our trainers, one of the best orthopedic doctors we have in the country, si Dr. JP Leong.
So what's the what are the needs right now for the program to be sustained?
Well, right now, actually, ang nakikita talaga namin because most of our beneficiaries really come from poor families, no? So, ang approach naman natin is not just really the treatment of clubfoot, but siyempre holistic ang approach natin, yung child development.
Right.
Sometimes they really come from far areas and they really have to commute in. Ang pinakamarami naming pasyente talaga ay coming from Vicente Soto. uh,
Where I
Vicente Soto.
was. I
So
was born
Vicente,
there.
oh, okay. Oh, so
Yeah, Cebu,
Sa
Cebu.
Cebu talaga ang pinakamadami
Talaga.
namin because patients come from Bohol, they come
Oh,
from
kasi hub yun eh.
Dumaguete,
Cebu is
oo,
central
oo.
in
So
the deformities.
right now, we have more than 3,000 children in the program supported by Miracle Feet providing. Pero nakikita namin na sometimes, they really need mga pamasahe, and if they live far, kailangan silang mag-overnight doon. Pero kung wala silang naipon, for example, syempre, iipon nila yung pera nila para makapagpa-check up. Kung hindi naman nila makaya, mamimiss na naman nila. Yun yung nakikita talaga
Yun ang
namin.
problema, no? Yung mobility
Oo.
nila kasi
Mm.
free nga yung service but they don't have enough means to travel and
Mhm,
get sa
mhm, mm.
mga titirahan.
Yeah. We
Pag,
appeal also sa mga LGU, so nire-refer namin sila. We also provide dun sa talagang mga indigents and I think that at ni-refer talaga ng hospitals, we also provide transportation but siyempre hindi yun enough. We wish that we could provide more, no? Kasi mga babies ito eh, kailangan
so kung
continuous
ano,
yung
for
nutrition
example,
nila.
oo, here in the US, mga Filipino dito, they may want to help. So how
Mm.
how are we going to keep in touch with your office? Ano yung website or who to
Oo. Well, they can email me at info@pngoc.com.
info, let me write that down, pngoc.com.
And then meron din po kaming Facebook page, yung Philippine National Clubfoot Program. That's our Facebook page. We have a website that we're updating at the moment. So yung PNGOC, www.pngoc.net. Um, Maganda talaga. I wish 'no, one of the things I think siguro yung mga kababayan natin can help us with, ang
Mm.
nakikita namin, yung children,
Mm.
yung mga writing materials, mga books, yung mga baby books, mga cloth type of books, kasi they're so uncomfortable when you put the cast on them. And I've
Yeah.
seen that when I visited the homes. Sometimes the children daw, the kids that I visited,
Mm.
irritable sila. Siyempre hindi rin
Yes.
comfortable. So
Mm.
but when we brought some writing materials to them, mga books, it helps also
Mm.
the mom kasi hindi na
Oo, kasi
nakakalmado sila.
toxin yan.
Oo, and then
Restless ang mga bata eh.
restless yung mga bata. So I wish that we could really do more for these kids.
So, for
Uh,
example, maski ako halimbawa, I could send mga books ng children's books, and then you can do that as a supplement to the entire, program.
No, we can send them dun sa aming mga clinic. So every time
Oo,
sila
para
magpa-check,
child-friendly talaga.
every time sila magpa-check-up, they could actually select a book siguro, and then makakatulong 'yon. Nakikita natin. These are just simple things that we can give our kids. Malaking bagay din 'yan do'n sa mga nanay kasi kids talagang they're drawn to drawings, they're drawn to all these
Pa yan.
things.
So,
Makakatulong siguro
yeah.
to really calm them. And
So, the art
um
can help.
Oo, oo. So, isa 'yun sa mga napansin namin na, when we visited and we bought a lot of we brought crayons and writing stuff, talagang makita mo yung talagang nag-lit up yung
Ayos
mata ng
nila.
bata. Hindi, kasi siyempre
Correct.
even if uncomfortable siya, bibigyan lang siya ng nanay to read, ano.
Stimulate pa rin yung brain niya
Oo,
eh.
mas-stimulate pa rin yung brain niya. So that's one thing. And yung and siguro kung sino man, no, I mean, our NGO is also accredited by the DSWD.
Mm.
So any donations or support, we welcome that. And then lahat naman 'yan mapupunta dun sa ating mga kids kasi talagang it's sa amin, we're still really raising funds so that we can also provide additional assistance sa kanila. Kasi kahit na very deep yung pockets ng ating funder, kasi also sometimes sinasabi namin sa kanila na po yung ito, kailangan nila ng pamasahe, talagang nagbibigay pa din kami ng pamasahe. But of course, yung meals, it's not enough then,
Right.
because they have to stay. For example, sa Cagayan de Oro, we had one family, nagigising sila ng 3 a.m. so that they can catch the 5 a.m. bus. Dahil 4 hours away ang Cagayan de Oro from Valencia.
Oo,
So,
ganun.
gano'n ka taga. So, they really have to stay the whole day. So, lahat 'yan mga meals. Yung iba nga sabi nila, "Baon na namin lahat ng kusina, ma'am." Kasi nandun daw sila sa parking lot ng ospital kasi buong
Oo,
pamilya na kumakain na. So,
gano'n.
ito yung mga realities
Things like that, like
natin, 'no?
play up, and our help is there, but it's never always on time, di ba?
Never enough
So,
and never
I
pero
salute you for what you're doing all these
okay,
years.
thank
Grabe,
you.
20 years ka na gumagawa ng development work, di ba?
I've
And
been in the NGO sector
how is
for
it?
more
I
than
mean,
20.
looking back, comparing now and before, did we, in terms of health situation in the Philippines, improve? Or is it getting just the same? Wala pa ring improvement? How is it? At
I
the
think
health
there's a
sector,
lot.
I'm asking on a general term.
I think there's a lot of improvement. I mean,
Yeah,
civil
there is.
society, I think for the health sector, hindi ko alam, I can't speak for the other sectors. I think for the health sector, we have a very good relationship with our local government and national government.
Huh?
Maganda yung interaction. There's a lot of consultations that are being done. Pag pinag-usapan naman talaga yung budget, lahat naman ng sektor siguro, lahat ng department will say it's never enough. But for us, 'pag health talaga,
Mm-hmm.
a government's support for health is one top measure of how your government values you para sa akin, ano. 'Pag maganda yung programa mo sa health, ibig sabihin yung pamahalaan mo really values
Here's
your life, oo. Kasi kagaya niyan, 'di ba? I mean, ito very time sensitive ito, every week kailangan. For example, sa PhilHealth,
mm-hmm.
ang casting sa PhilHealth, naka-lump kasi yung casting do'n sa parang as if, aksidente siya or nabalian siya. Pero
Oh,
ito every week. So sa programa natin ngayon sa PhilHealth, a
oh,
hospital can charge casting every 3 months. But in the case of clubfoot, every week yung casting niya. So halimbawa kung sa private hospital ka, kahit may PhilHealth ka,
mm.
after 3 months ka pa makaka-charge ulit. So the rest of the every week na gagawing casting ng anak mo, babayadan mo yun, hindi mababawasan ng
So out
PhilHealth.
of
So,
pocket.
oo. So, actually hanggang ngayon naman, kahit na may PhilHealth tayo, malaki pa din talaga yung out of pocket natin na binabayadan talaga. So, I think 50% pa rin ng ating gastos sa health, according dun sa National Demographic and Health Survey, ay out of pocket. So, you can just imagine, even if itong mga beneficiaries natin are going into our public facilities, libre yung mga gagaling na doktor natin in our public facilities, siyempre marami pa rin silang gastos, hindi lang naman yun yung magiging sakit ng anak nila, so they have to deal with that also.
Yeah.
So kaya kailangan talaga yung nutrition ng bata, so tinitingnan namin na kung we really have to provide mga additional, baka may vitamin supplements tayo that we can also provide to them, bibigyan natin, makakadagdag yon so that they won't miss out on all the treatment kasi nagkasakit sila. Lalo pa ngayon sa panahon natin, ano, pabago-bago yung panahon, nagkakasakit mga bata.
So, in the past, like you're working under the development work industry. Ano yan eh, mga ilang presidents ka na under. So, ano yung mataas ba ang budget ng mga presidente ng mga lahat ng administration sa health, and how come it's still never enough? Like for example lang, sasabihin nila there's universal health care, but it's not really universal because you pay a lot. You pay out of pocket more than what is being subsidized. So anong context ng universal health care na yan?
Actually, we're just the law is fairly new.
Yeah.
So a lot of the things sa universal healthcare, parang one of the things na sinasabi doon kailangan na public facility, no balance billing.
Oh.
Kung talagang lahat ay charge natin because we have our insurance, hindi mo kailangan magbayad. But there are still a little that you still pay. But those who can, you can afford, kasi pag sinabi universal healthcare, ang premise nun is dapat yung kalidad ng serbisyo ay pantay-pantay.
Ah,
So whether pumunta ka sa pribadong sektor o sa
that's the
private
context.
facilities, pare-pareho, and then standardize yung mga cost. So yung mga gano'n. But it's still fairly new. Marami pa din talagang adjustments na nangyayari. Tapos inabutan pa tayo ng pandemic. Yung time na talaga magki-kick off na yung ating
Uh-huh.
universal healthcare,
Oh,
lalagyan siya ng tamang tumataas ang pondo niya, nagkaroon naman tayo ng pandemya. So, na in a way, no, na-cripple ang ating health system, ang ating health facilities, then addressing itong problema na to. But I think in principle, maganda yung universal healthcare. Kasi parang maraming bansa kasi gano'n naman parang
oh,
kailangan yung kalidad ng serbisyo mo ay pantay-pantay kasi dapat yung ang sakit naman hindi pinipili mayaman o mahirap So dapat
correct.
pare-pareho yung
Ang service.
kalidad ng service
So,
natin.
right. So, Chi, I have a personal question. Kasi kasama tayo sa media, and then and you are now back again on top of this work as executive director. So ano bang mas mas ano sa mas exciting being a media person or a or a non-profit executive?
That's a tough one. I think, well,
Perky ha,
I've
sa
al
media.
oh, I think I've always been sabi ko nga, kasi ang background ko nga sa film, eh. Sabi ko, I think I'm an NGO worker who makes films. So, parang gano'n din. I think I'm an
Ah,
NGO worker who also writes, who
yeah,
also co-manages
right,
yung women writing women.
right, right.
I think my work allows me to really,
So, ayan tayo.
oo nga.
Good
I
kayo.
think the work allows me to look into more situations, and then to be the voice, I think, because I'm able to really see yung kanilang mga kwento, parang na-amplify natin mga
It's
hindi
really a
natin
plus factor,
nalalaman.
right? To
Oo, I think it's a
this.
plus factor. But I think mangyari niyan, I'm a para tayong mga volunteer media. No, wala tayong organization.
Mhm.
Uh, I think sometimes, I look at your lives, kayo ng talagang no, sabi ko parang napaka-exciting yung mga ginagawa nila. They get to meet a lot of people, and then they get to ask you know, the questions that nobody likes to ask.
Yeah,
Kasi
it's
parang meron
actually
kayong
more
ID that
interesting to do.
naku, itong ID ko tells me that I can ask that. O kayo hindi niyo matatanong yun.
Yan siguro isa ring downside. If I'm correct kasi halimbawa, I mean in your advocacy work, you write your project proposals. You need to tweak it to the interest of your funding agency, di ba? So
Well,
how do you balance that? But that
I
you
think
you have in mind the community still.
I think in practice talaga we really search the supporters who are in line with our objectives as an
You mean the
organization.
funding agencies?
For example, we don't adjust our programs so that it can be funded.
Okay.
We find funders who believe in the work that we do. And I
Okay.
think over the last 20 years, we've been quite lucky to have found, very good partners,
But then
because
it's tough, right? It's
it
tough.
is tough. It is tough. We've lost some staff, because we can't continue the program. And I think that's the reason why we also work with local government. We work with the national government so that the programs can be continued. For example, the program that we've completed through the support of the Bill and Melinda Gates Foundation, it
Yeah.
has resulted in more than 30 policies in the area. We've
Mhm.
seen the changes, for example, among all the health professionals there. They're continuing the work that has been ignited by the project, kasi we can't stay there forever, no. So ang sa amin talaga, kailangan ma-empower sila to continue,
Right.
because we're not there. We're not It's their place, it's their town, it's their province. So yon. Pero kami at the national level, we still continue. Every year naman, talagang kailangan ng budget. Ang budget ng Pilipinas, I think hindi pa natin nami-meet every year yung requirement, yung recommendation ng WHO na at least 5% ng budget, national
So how
budget,
much
ay
is it
for her.
for now? How much?
I don't know, because ngayon pa lang yung ating national budget, deliberation national budget. But yung previous
Towards the end of
year,
the year, right?
mga gano'n, 'no.
Huh?
So I think mga 3% or 4%. So sana tumaas, kasi may iba pa naman pinagkukunan, I think. Ngayon kasi iba na rin yung, I think PhilHealth will have a different funding mechanism now. Yung
Okay.
ating local government units will have a bigger chunk of the PhilHealth budget. So
So
sana
parang
mas
parang
makatulong.
binibigyan ng more budget na ang mga locals.
Oh, kasi devolved yung ating government. And one of the things that are devolved is yung health services. So it
Mhm.
has been very difficult dun sa local government unit natin pag hindi naman enough yung kanilang funds to provide for all their constituents. So kailangan, kagaya niyan. So halimbawa, ang layo pa ng ibabiyahe nila para lang magpagamot, for example, for clubfoot. But
Right.
sana if all the provinces have this program, they have trained pediatric ortho, nakapag-train sa amin, napagpatuloy nila, nabibigyan nila ng pondo, di hindi na kailangan mag-travel pa. But at the moment, yun, meron tayong 30 pa lang yung ating mga hospitals. So,
So,
it's not enough.
so, yeah, as you are saying, I think everybody's cooperation is needed. The private sector,
Yes.
cities, the government, and the nonprofits, like such as yours. So
Yeah.
I wish everybody would take a look at this, and you could provide whatever help for the children you can. Just email my good friend G, who is the executive director right now of the PNGOC,
NGOC.
PNGOC in the Philippines. It's info@pngoc.com. So remember that. And so one more question before we wrap up and we say bye bye, Chi. Um, how do you envision as a development worker and as an active part of media advocacy as well? What is your vision for the Philippines, our beloved Philippines? Sana ano yun?
Sana ang Pilipinas, we're not beholden to any politician.
Mhm.
Sana lahat ng Pilipino na alam nila yung worth nila. So they can start demanding for better service,
Mhm.
hindi sila yung laging nakikiusap o hindi sila natatakot, wala silang
Yeah,
takot. And I see that in many developed countries that they can actually demand,
yes,
they can complain, they say,
without fear.
without fear because they say, tax ko to.
Correct.
Ang problema sa mga mahirap iniisip nila, kasi po ano lang ako, informal sector ako, nagtitinda ako, hindi yata ako nagbabayad ng tax. Mali. Lahat ng bagay na binibili mo may tax, nagko-contribute tayo. Lahat, gasolina, grocery, naka-tax yun. Lahat ng kinakain natin naka-tax.
Mas
Even if
marami pa ngang
hindi,
tax ang binabayad ang poor kasi puro retail ang
oh,
binibili.
'di ba? At hindi nila iniisip na, kasi tayo nag-file tayo sa BIR, hindi lang 'yon.
Mm-mm.
So, hindi lang about tax, kailangan alam natin yung value natin as a Filipino. So, I hope Filipinos will realize that let's value ourselves. Let's start demanding better quality service because we deserve it.
Well said. Thank you so much, Chi. Sarap
Thank you
naman.
so much for this opportunity.
And all the best sa campaign. And
Thank
we will be
you.
in touch, okay? Thank you so
Oo,
much for,
maraming salamat.
and tonight, 11 o'clock na dyan, di ba? So, time
I
to
took a nap.
right. Take a
Sorry.
nap. Awesome. So, till the next conversation. And take care,
Okay.
Janchi. Always be safe.
Ikaw
And
din, ikaw
see
din.
you.
So, have a good day
Bukas.
to you.
I will. Thank you. Bye bye for now. God bless everyone.
Bye.
Bye.